Hello, everybody. Today we are going to be discussing smartphone technology and the hope that that brings to Alzheimer's disease. But before we actually jump in, I want to make sure everybody understands the effect of Alzheimer's disease upon the family and the healthcare system, as well as its relationship to current practice. Now, when I refer to Alzheimer's disease, I want to include other related dementias as well. In written form, you will be seeing this as AD/ADRD, but Alzheimer's disease itself is characterized by cognitive dysfunction, behavioral disorders, and functional disability, which leads to a lot of stress being built up upon the patient and the family themselves. The effect of Alzheimer's disease upon healthcare is quite profound. In about 30 years, it's estimated that the number of people aged 65 and older will be 88 million. The cost in the year 2010 for the care of Alzheimer's disease was between 159 to 215 billion dollars. Now, this just goes to show the burden, the financial burden that Alzheimer's disease is upon the healthcare system. And unfortunately, a lot of that burden is carried by the family, as half of the long-term care costs are paid for by the family, which then depletes them of resources that are necessary to care for their own healthcare needs. The relationship to current practice, we see that there is an incredible demand for geriatric caregivers because an individual with Alzheimer's disease has the likelihood of being hospitalized 2 to 3 times more than that of an individual without Alzheimer's disease. And as we also have no pharmacological means by which we can prevent or cure Alzheimer's disease, we are expecting to see this simply increase. Furthermore, the lack of public knowledge on the matter increases the isolation of patients and their caregivers, and the surveillance of families that are caring for people with Alzheimer's disease is limited at this point, leading to an inaccurate understanding of the challenges that they are facing, as well as an inaccurate understanding of the interventions that are necessary. So why is this important to healthcare informatics? We see that healthcare informatics often goes into a situation or a problem and provides a cost-effective solution that increases the quality of data, provides a non-pharmacological intervention to something that is needed, and improves the overall functioning of the system. So it is hoped that healthcare informatics can provide these exact same benefits to people that are debilitated by Alzheimer's disease and their families. Marasova et al. In their study seemed to believe that healthcare informatics actually can make a difference. In their study about applying technological interventions to the older population with Alzheimer's disease, they found that the caregivers reported an increased quality of sleep and a decreased sense of despair. So perhaps healthcare informatics is the answer for the meanwhile. What other research-based conclusions can we make? Well, Al-Falki and Al-Otaibi identified 4 primary areas where smartphone technology can help make a difference. In their study, they found that memory loss, safety, awareness, and activities of daily living were the most primary areas of need for people with Alzheimer's disease. To prevent memory loss, an Android application known as Backup Memory was developed, which allows the user to upload photos of family and friends along with descriptions of their life, relationship, and other pertinent information, so that when a family member calls or is present with the user, their photo appears, and this helps jog the memory of the user. Other applications were studied that also help increase memory and prevent memory loss, and all of these were found effective and beneficial to the user. Safety is one of the primary concerns for caregivers and one of the primary strains upon them. So Pavlakis et al. Developed an application which uses multimedia to sense when the smartphone and the user have fallen. The impact of the fall begins a 30-second countdown, at the end of which a text message is sent to a designated first responder, unless the countdown is deactivated by the user. To increase awareness of Alzheimer's disease, there was an application developed by Cindy et al., which can effectively predict the development of Alzheimer's disease 20 years before an actual diagnosis. Now, this predicament is based off of data input from the user, such as physical activity, education, and health history. They didn't actually mention this in the study, but one of the conclusions that I drew was that the collection of this data from the risk assessments could be quite beneficial to health informatics and public health policy, as we could collect that information, track it, and return to those individuals in the coming years to see how they're doing and develop a more what's the word I'm looking for? A more informative and expansive database from which we can draw conclusions about the population, location, and activities which place an individual at risk. This would hopefully help for the improvement of interventions that could be set in place. To increase independence of the individual, an application was developed that helps remind the individual how to and when to complete their activities of daily living. An audio reminder prompts the user to take their medications, complete their hygiene, eat breakfast, etc. So, what are some of the ethical and legal considerations to keep in mind? I found that the three main ones were privacy, confidentiality, and reimbursement. Haluza et al. Discusses the attitude of many towards the technological monitoring systems which can track GPS location or even use video to monitor the daily activities of the individuals. It is stated in their study that there was quite the initial opposition towards such an invasion of privacy, yet once it was understood that this was a way of increasing the independence of these individuals, those concerns and that opposition disappeared. Confidentiality is also an important topic and concern because large amounts of data are going to be produced, and without confidentiality laws, there's no saying what will happen to this data. Thankfully, HIPAA is on top of things as usual and has set in place a variety of guidelines which are specifically written for application to virtual health management systems such as PACE. Lastly, reimbursement is an issue that we don't really have to focus on at the moment because these applications, such as smartphone applications and the smartphone itself, are quite cost effective, low cost, or even free. But depending on the technology that is developed at a later date, we may see reimbursement issues becoming a bigger problem because at the moment, insurance companies don't usually cover for the payment of applications such as, an Android application to help with your health. But that might be something that we can talk about in the future. So the plan for change focuses primarily on education of the healthcare team, such as the doctors, nurses, case management, and the family members as well, of course. Sartori et al. Suggest using people who can effectively set an attitude that is positive towards change within an organization. And these people are known as innovation leaders, which can then help guide and shepherd the change into action so that more people are willing to adopt the change. Online learning modules would be available for ongoing training so that they can remain updated day by day and new applications and technology that are developed can become available to providers. To monitor and evaluate the success of this change, caregivers and patients would be the primary source of assessment. There would be surveys that they can fill out, but one of the most important gauges would be their verbal report during follow-up appointments at a later date. The cost for these educational training interventions would have to primarily be taken care of by private investors, as unfortunately, as mentioned before, insurance does not yet provide coverage for such things. However, Bill Gates himself just donated $50 million back in 2017 for the research of Alzheimer's disease, so it is hopeful that further investors will step up to the cause. And thankfully, the availability of the smartphone does help to reduce costs. What is the future perspective that we can begin imagining for the use of such technology? How will public policy influence this? Well, I believe that we're going to see greater personalization throughout the development of technology, and that we're going to see virtual reality and artificial intelligence developed into the everyday home. This is actually already taking place in some small degree. Camineo Care incorporates artificial intelligence within the home to provide higher quality life and more useful, efficient ways of completing tasks for people that have disabilities such as Alzheimer's. There is also hope that public policy will strongly push for research by incentivizing those things financially and therefore encouraging the use of technology within the masses. We see that the situation with Alzheimer's disease at the moment is fairly bleak, yet thanks to healthcare informatics, I believe that we can provide the support and hope that is lacking until a cure or prevention for Alzheimer's disease is discovered. Until then, thank you so much for listening.